there. It's such a great honor, to come your way, once again. We thank God for another weekend. And just like we do on the Inside View, we always try our best to educate and also to enlighten people. That's what we do. And, we all know that diabetes is really affecting a lot of people. But surprisingly, there isn't much education or should I say publicity on it until you get this horrible disease. I mean, that's when you try to fish out more on it. Today on the Inside View, we are so privileged to have Dr. Sohail Ahmed, who just recently got nominated for the National GP Awards. Dr. Sohail, it's such a pleasure to have you on Inside View.
Good evening, Nana. Good evening, everybody.
Hi, good evening. Yeah, and how are you?
I'm great, thank you. Thank you very much. Thank you for having me on the show.
Good.
Really looking forward to this much needed topic.
Interesting. Good. So, I mean, how does it feel to get nominated, as a GP? I mean, for all the GPs, and you get nominated, as one of the outstanding GPs. How does it feel?
It was very humbling. It was a surprise. It was kind of a shock because it was in the year of the pandemic, going back to 2021. So it's an unprecedented year where every single healthcare professional, regardless of whether it's a GP, nurse, paramedics, hospitals, everybody went way beyond anything that we'd done before, um, in the world, really, not just the UK. And so it was a completely unprecedented time, and to be recognized in that, I don't think I did anything beyond what anybody else would have done in that year. Every single person needs to be recognized and needs to be applauded for what they've done. So it just made it even more special for that year of all years to be uh, nominated and recognized for the work we've done. And it's such a profession that we don't we rarely get any sort of recognition or any sort of acknowledgement. It's a job for us as healthcare professionals. We see it as a calling, as a job, and we do whatever we can do. And it's rarely that we actually get any real notice for doing anything special. Yeah, you're just doing your job, get on with it, kind of thing. So to be recognized, and it was humbling. And one of the things that I didn't um, reckon on was the impact it had on my friends and family, how proud it made them. So that made it even more special because,
Oh,
like I say, it's my day job. I do it every day, so it's fine. I get on with it. But for my family, they suffer with me as well. My
yeah.
my wife, my children, my parents, my extended friends and family circle, they don't see us for weeks and weeks. We're busy working. So this award, the recognitions, it's kind of nice to see family see that as well and be proud of it, and to see that, yes, we're all part of it, because I wouldn't be here if it wasn't for my family and my friends and them allowing me to do this work,
Mm.
and sacrificing my family life and my personal life to achieve all that in healthcare for other people. So it's a lot bigger than me, or just what the work I do. It's a team effort, my surgery, my staff, my family. So it really is, it was nice to see all the staff and family be proud and be part of the journey. So yes, thank you very much. It was very nice.
And congratulations on that.
Thank
That's
you.
Sahil. Growing up as a child, did you always wanted to be a doctor, or you had anything in mind? You know, um, have you always wanted to become a doctor?
um I wanted to do something to help others, and
Mm.
whether that meant being a doctor or anything else. I mean, I just knew that I wanted to do something um, to be useful to humankind, to be useful for other people, and to make a change.
Okay.
And it just so happens that being a medical professional, being a doctor, allows, it's a privileged blessed role that allows me and people in this profession to do that in an obvious manner, so to speak. But there are many other professions out there. Any profession can be, what you're doing here. Um, in your work, if somebody's a minister, somebody's a lawyer, somebody's a teacher, everything and anything can be life changing to other people. So I suppose the short answer is yes, probably. It was something healthcare related I would have probably done, but ultimately anything that would have impacted the lives of others would have been my calling.
Good. Wow, because the reason why I asked is, we have a lot of people not knowing what to do, and and some will tell you, "Oh, I wanted to become a lawyer, but maybe my parents actually wanted to become a doctor." So I
Yeah.
had to listen to my parents. So we just ask, and also we have a lot of young boys out there not knowing what to do with their lives. So
Hmm.
when you just give a little bit background of yourself, sometimes it helps these young ones to
Yeah.
help them focus and also to help them rediscover themselves. So I'm so glad that you said that like you've always wanted to do something to
Yeah.
help humanity. Yeah, yeah,
I mean, on that, I don't know the demographic of your readers, sorry, your listeners and viewers, but from a background, a BAME background myself, an Asian, South Asian background, and I suspect I have many friends who are Afro-Caribbean. It's a
yeah,
cultural thing that it's always, either a doctor or a lawyer or an engineer, or
yeah,
these are the sort of the key areas that you are, I wouldn't say pressurized, but are regarded as high value,
yeah.
and there's an instinctive, sort of subconscious or sometimes very consciously push towards those areas. And if you say something like, well, I want to be an artist, well, yeah, that's fine, but make sure you're a doctor first, kind of thing. So I think there's this cultural baggage that we have sometimes, that these are the areas and anything else is a waste of time. But I think, what I would say on that is that anything that you do with a passion and anything that you do with, absolute excellence, and you put all your mind and heart into it, you will find your calling. And it doesn't have to be, specifically a profession. Like I have many of the
Mm.
passions that for the right answer for me when I was a child, I wanted to be a journalist. I wanted
Sure.
to write, these. So there's no reason you can't do those things. I mean, I carried on doing that within my profession, within medicine and beyond. I've gone on and done that because I was passionate about it. And so your passion is always your passion. The worst scenario you can be in is, and I hear this many times, is that, oh well, I wanted to be, I don't know, I don't want to be a football player, but my mum wanted me to be a doctor. So I did this, but when I didn't become a doctor, then I got stuck in the middle somewhere, and now I don't know where I am, kind of thing. And that's a loss, because this person could have been a brilliant football player, but he would have been probably a mediocre healthcare professional. What would you rather have? Brilliance and excellence in something that is your calling and is your
Yeah.
heart is in it, or something that you're really not good at and your heart is not in it, but you've just done it to please somebody else. So
Mm.
you have to find that balance ultimately and find what you're passionate about in life.
Good. Before we, actually get on to today's topic, I would just, want to appreciate my sponsors. Today my makeup, was provided by, Creation by Viva, and also I have Yam Spice. If you happen to be in Bradford and you want a place to, um, also, just have some fun, and also, eat and eat well. We have Yam Spice, and also if you want your children to excel also in school and do exploits, yeah, we have the masterclass tutorials, and they also offer online, maths and tutoring. So their number is also on the screen: 07578950797. And my makeup was also actually applied by TNA Touch, and my hair was also fixed by TNA Touch. You can follow her also on Instagram. So thank you so much, all my sponsors. Welcome. Dr. Sohail, today we are talking about diabetes. What is diabetes? Because we've heard so much about it, and sometimes we get not too sure what exactly that disease is, even though it's claiming a lot of lives. What
Mm.
exactly is diabetes?
Yeah. So, yeah, before I begin, thank you, Nana, for highlighting this topic and reaching out to me. It's, well, most importantly, you, as always, look magnificent today. So,
Oh,
whoever's doing your work is doing a brilliant job. Every time I see you,
thank you.
you look completely different every time I see you, and amazing every time. So, I don't know who's doing
Letting
it or what's
myself
going on,
try. Thank you.
and I'd like to thank somebody as well, my wife, for my makeup. She insisted that I wear this shirt, so I must thank her for making the effort on my behalf. Um, but on a serious note, diabetes and various other conditions that you've reached out to me and highlight, this is very, very rare. I have not come across it, and it's something that has been in my radar, and I'm very, very passionate about, because these are, and I'll talk about what these conditions are and the impact that they have. But these are absolutely, vital topics, absolutely vital topics that are really not in the arena. That people are not talking about these, people are not aware of them, and there's no real publicity, like you said, or awareness on these topics, especially in communities from the background that we come from, the BAME background. These are
Yeah,
absolutely vital topics. So well done on this, you know I would say, revolutionary step that you've taken, and a leading step, to highlight this topic and reach out. And I hope, and I'm with you all the way, and we hope to get many more people on board that can talk
definitely.
about these and many other topics that are so crucial, and affect all our communities and all the people out there, and really make a lasting change for generations to come in terms of understanding and knowledge of such diseases.
Thank you.
um, so the question that you've asked about diabetes. So with what I'll talk about today, I want to keep it very simple. I'm not one for lectures, and lectures rarely help anybody. I
Yeah.
think the way we are as human beings, our nature is to learn from experience and learn from interaction and learn from personal interaction and involvement in anything that we learn. And to for me to give you a lecture on physiology and anatomy and the biology of insulin and the organs involved and whatever, it's unnecessary. What we need to take out of this session and these sort of sessions is what is the basic that you need to know to help yourself and to help other people around you, and the very basic information in a basic bite-sized manner that is useful to you, to be able to make the most out of that information and actually make changes in your life and the life of your loved ones and your community, to empower them with the relevant information, not be overburdened by irrelevant information and theoretical information, but practical advice and practical tools that you can change your life with. And that's, I hope, we can take away from this today.
I hope
Okay.
so too.
um, so diabetes, in simple terms, um, is a condition, it's a chronic condition that, thereby, where the individual who has diabetes, they lose the control of their blood sugar levels. So the human body is all about balance.
Hmm.
Okay, everything has to be in a balance. Your blood pressure, your cholesterol, um, your blood sugar levels, and many different things in the body have to be in the right balance. When that balance shifts either below or above where it should be, there lies a problem, there lies illness and disease. And in the case of diabetes, most people know the colloquial term, yeah, it means sugar. People call it, oh, you've got
Sugar,
sugar,
yeah.
or you've got sugar disease, or so what it essentially means is sugar is glucose is a type of sugar. Um, and the balance is abnormal. Your body is unable to control the sugar levels, the glucose level in your body. That's what it means. That's ultimately what it is. In simple terms, what are the implications of that, and why does it happen, is what we will talk about, and how you can prevent it happening or manage it if it's already happened to you.
Hmm.
Is that reasonable?
Sure, sure, sure.
Yeah.
I'll edge listeners out there. if you have any concerns, if you have any questions, because already people have sent me their questions here. But then if you happen to be online and you want to be part of this discussion, and also if you want to be educated as well tonight, please tune in and also invite as many people as you can, so that we can all be empowered, because knowledge is power. I mean, for you to know much about this horrible or deadly disease, I'll say that having read about it, I got so frightened, because it can damage a lot of organs in your
Yeah,
body, and we don't want that to happen to us. So if
absolutely.
you're online, please share this, share the link, share the link, share the
Yeah,
link, please. Thank you so much.
absolutely.
So, doctor, how many types of diabetes do we have?
Um, there's two main types of diabetes that are of importance, and I would say for today, I'd like to. I mean, we can talk about both, but I'd like to focus on type two. There's one called type one diabetes, and type two diabetes, and essentially the definition is still the same. It's
Okay.
an imbalance of blood sugar levels in the body. Type one, in simple terms, they keep changing the definitions of it. Sometimes it's type 1 insulin dependent, you'll hear the terms. Type 2 is or sometimes called non-insulin dependent, or age-related diabetes. The main difference between it
Mm-hmm.
is that in type 1 is usually younger people, a lot younger. So it could be any age, from kids. Usually you won't get anybody beyond the age of 25, 30 that is type 1 diabetes, but because by that time they'd be very unwell and it would get picked up very early in their life. And
Okay.
the type 2 is usually the older one. It's the more relevant one for most of our listeners and the communities that we serve, is the type 2 diabetes, which is usually comes with age. And the typical sort of image we have of diabetes, of somebody who's older, who's overweight, and gets diabetes as they get older in life. So that's the type 2, and that's the most prevalent. 90% of diabetes is type 2, around about 10% is type 1. And it's a much bigger impact that type 2 has in comparison. So I think for this discussion, unless somebody has specific questions about type 1, I'd say we would focus on type 2 for this one. Now, just to give you some numbers, some stats to really outline the cold hard facts of what diabetes is. And sometimes numbers are good to give you an idea of where the balance of this disease lies. So in the UK, there are, I mean, this is last year's figures, so maybe higher now, but in the region of 4 million people, 4 million people that have diabetes. Okay. Um, and it's one of the most rapidly growing diseases there is, one of the most, we call it prevalent. In fact, it's the most prevalent chronic disease there is in the UK. And an estimated 1 in 20 people have diabetes. So that's at this moment in time. The estimation based on the growth of this disease is that by 10 years time there will be 14 million people with diabetes.
That's a lot.
Yeah,
That's a lot.
absolutely. It's and the to the NHS at this moment in time, the burden on the NHS, so the amount of money it costs the NHS in terms of percentage and in terms of the cost itself, is over 10 billion pounds in the UK, which is 10% of the NHS budget is spent on diabetes and the complications resulting from diabetes. Okay, so these are some hard facts. Now, what are more worrying facts than even these? Projected potentially in the millions as well. So these are people who are walking around like normal, and are unaware that they have diabetes. So these numbers are those that have confirmed diagnosis and are aware that they have diabetes, are on treatment for diabetes. And there's potentially a good million plus that actually don't even know, are undiagnosed diabetics out there. And so this is the alarming number, and that's the number that needs targeting and needs awareness to be caught and actioned. Now, again, going back to the communities that we work with and our background that we come from a BAME background, this disease is even more relevant, much more relevant. Um, as COVID highlighted many inequalities in health and disease. In the same way, diabetes is one of those conditions that is so much higher in the BAME background, people of BAME background, up to 6 times as higher in certain ethnic minority groups, ethnicities, than it is in white English background. So it's a huge disproportionate ratio of people who are likely to get diabetes type 2, Black, Asian, ethnic minority background compared to any other ethnicity. So therefore, as a population, this is the population that is at the highest risk, up to 4 times high in Black Afro-Caribbeans, up to 6 times high in certain ethnic Asians, Bangladeshi, Pakistani, Indian. So huge numbers. And the sad part is that these are probably the populations that have the least awareness of understanding and outreach for this subject. That's even more worrying. That's even more worrying.
It is.
So yeah, the numbers are all against us, really. I mean,
It is, yeah.
it's a stark reminder of where we are. So those are some of the numbers. Sorry. Um, so, how, do you have any questions at this
Yes,
stage that
what
you?
causes it at all? What causes diabetes? What causes diabetes?
Yeah. So in terms of the causes, the there's the actual the biology of what's causing it and what's going wrong. Okay, but before you even get to that, I think the important element of causation is the risk factors. So who is at risk? Who is likely to uh, get the diabetes? And then those people, if they are part of that high risk group, can try and either avoid it or be more aware of it. So in terms of risk factors, we've mentioned already ethnicity. So there is a huge genetic component. If you come from a certain ethnic background, you already you're higher risk already. So you could have, for example, two people. So person from a BAME background and a person who's from white English background could have exactly the same diet, exactly the same sort of physical, weight and body size and everything could be exactly the same. But the person who's from a BAME background, because of their genetics, is at a higher risk. So no fault of their own, they've inherited this as a a risk factor that their likelihood of having diabetes is higher. So there's unfortunately it's just genetics that they can't really change much about. So that's a huge factor as well. We call it family history. So if you've got, for example, your parents, your grandparents had diabetes, you are at a higher risk of diabetes. Age is a big determinant as well. So as your age increases, your risk of diabetes increases with age. Obesity is a huge one, huge. Diet, lifestyle changes, factors, your dietary choices in life, and also if you are overweight, that's a huge one of the main factors that causes diabetes. Okay, so these are all the risk factors that put you at a higher risk. Okay, so what causes it from a biological point of view? And again, I won't go into too much detail of the anatomy, but um, when you eat foods which are carbohydrates, they go into your system. So the different types of food, there's proteins, meat is protein based, there's carbohydrates, there's fats, the different types of foods. Specifically, what matters in diabetes is carbohydrates, the type of foods that are uh, building blocks are carbohydrates. When you ingest carbohydrates, you eat anything with carbohydrates, which is practically everything these days. So the classical foods that you think of, we call them beige food, sort of, so bread, the rice, whatever wheat related pastries, carbohydrates, these are all carbohydrates. And they shoot up your blood sugar levels. So in a normal person, you have something to eat and drink, it goes into your system, it gets broken down, absorbed into your digestive tract and broken down, and your body starts using the carbohydrates, breaking it down into glucose and utilizing that for energy. Simple so far. What goes wrong in normal circumstances, an organ in your body called the pancreas produces insulin and various other chemicals are produced, and they balance out. So they reduce that spike in blood sugar levels and they balance it out. So it allows your body to maintain a nice level of glucose in your bloodstream that you can utilize. And that's the balance that it creates, and everything's happy and fine. What happens in diabetes is, for different reasons, that your body now is not producing those chemicals in the right proportion, not producing enough, or your body is no longer able to respond to the production of those chemicals, and the balance shifts. So what happens is that your body is no longer able to bring that high level of glucose down to a normal level and plateau, and it becomes very erratic and it keeps shooting up into higher levels of glucose. So you have very high levels of glucose, sugar, in your bloodstream. That's what we call technical terms pathology of diabetes in simple terms. So in essence, a person with diabetes has high blood sugars in their system at most of the time, and they're unregulated. They're just all over the place. That's the problem.
Okay,
That
that's
makes
second.
sense?
Yeah, sure. I mean, with carbohydrate being the determining, factor, that actually, raises our blood sugar. What should, be the accurate blood sugar when someone wakes up, and also before meal, to get the accurate blood sugar.
Yeah. So again, the sugar level as a ballpark figure, if you get one of these machines that you buy from the chemist these days, you can buy,
That's
and
the average, the average blood sugar level.
yeah. So you do your blood sugar finger prick test and blood sugar. Now, I should say this at the beginning is that um, whatever I'm saying, this is all generic information that I'm giving. If
Yeah,
somebody out there listening has diabetes and they do have a blood sugar machine, then it requires specific information for them, because everybody is different and their
that's true.
targets and their normal for them is different. So whatever I'm saying, I'm giving a disclaimer, is that it's not applicable to every scenario.
Sure.
Okay, because somebody who has diabetes type 1 or type 2 or is on certain medications, their normal is not the same as somebody else, if that makes sense. So
Sure.
this is not medical advice that I'm giving people. This is just generic information
Okay.
and general information. If somebody has a condition, has concerns about their own sugar levels and their own health, they need to obviously seek, you can ask a question here if they want, but they need to seek, medical advice from their own healthcare professional to get the relevant numbers if they're not sure about those.
Mm.
But in general terms, yes, you can have averages and ranges within normal. So when somebody gets this machine and they do the blood sugar test on themselves, and it gives a reading, it says 4.5, 5, 6, these sort of readings. What is the value of these? Are they important? Are they a good measure? They can be, but there's a number of things people need to consider in this. So the blood sugar levels fluctuate quite widely for everybody. So if
Mm.
you wake up in the morning and you're empty and you've not had anything to eat since the night before, and you check your blood sugar levels, they will be quite low. Could be 3.5, 4. Okay, it doesn't mean that you're unwell. It's because you haven't had anything to eat and drink, and you're practically fasting. So that's within normal. Now, if you have, say, for example, you have a very you have a cake or a very sort of sugary dessert or something, okay, and within 15-20 minutes you decide to check your blood sugar levels. Now you don't have diabetes. If a normal person, you don't have diabetes, and you check it, it's going to be sky high. It could be 12, 13, 14. It could be quite high. Again, that doesn't mean that you have diabetes. That means you've had too much dessert. you know it doesn't give you a diagnosis of diabetes. So we have to be proportionate in how we measure that. Okay, so there are cutoffs of what is within normal and then what is completely. So for example, if you were to do that and it's 25, say for example, well, that's trouble. That's worrying. So you need to check your blood sugar levels and see if it's sugar. This is now something dangerous. Okay, so there
Sure.
comes a point where you need to seek advice. um, in terms of the actual diagnosis, how it's made. So I get a lot of times I get patients who bring those readings, and they've been doing the readings for a couple of days or weeks, and say, well, doctor, it's always high, it's always high. I think I've got diabetes. That's not a diagnosis. If you can spend a whole week doing 4 readings a day and they're all high, it doesn't mean that you have a diagnosis of diabetes. The diagnosis is made with a special blood test that your GP will do here in the UK. And that blood test is, it's not the one for your finger, it's an actual blood test that's taken from your arm. And that blood test, is the value and the importance of it is that it looks at the sugar levels over the last 12 weeks, sort of 6 to 12 weeks as an average, over the last period of 6 to 12 weeks, and it gives us an average. Okay, the technical term for it is HbA1c, and it gives us the glucose level in your system over that period of months, okay, that have gone before that blood test. And that is what gives us the diagnosis. If it's higher than a certain figure, around about 50, then we say that this person has diabetes, because this means that consistently over the last 3 months, their sugar levels have been high, and that level gives us the diagnosis. It's not the home readings that you do here and there and everywhere. That's not going to give you the diagnosis. Does that make sense?
Yeah, sure.
Yeah.
Yeah, before we go on, I've got a question online. There's a gentleman called Kwame Nyako. He says, is diabetes curable? Was diagnosed 6 years ago after acute kidney injury. 5 years since, it appears blood sugar is reasonably it's reasonable. Sorry, it's reasonable,
Yeah.
and no medication for 5 years. I'm just wondering.
Yes. Yes. So again, that's a question leading more on to treatment and various things. I've made a note of that, so I can touch on that when we talk about the treatment. So far we've talked about risk factors, what diabetes is. I think. Did
Yeah, we
you have
talk
any
about
questions on these topics before I move on to the next one? Because
no.
what I don't want to do is move on to a topic that's later down the line and miss anything important in the process. So I'll touch on the
Okay, that's
treatment
fine. Yeah,
towards
if
the
there's
end.
anything, yeah, I'll let you know, because I've got
Yeah.
some questions that people have sent to me that is just related to the questions coming. What are some of the symptoms of
Yeah.
diabetes?
Yeah, that's what I was going to go on to next, because obviously now we know what diabetes is, we know who's going to get it, and we know what it means. But how do you know you've got it? And how do you know if somebody else has got it in your family? These are very, very important questions. So the symptoms of diabetes. So we know that diabetes is abnormal blood sugar levels, abnormal as in high. So what does that lead to? What does that cause? And how would somebody know? So as an example, I would say, if there's somebody, I don't know, you've got a family member, a loved one in their 50s, and they start having very strange symptoms. What symptoms would pinpoint that they might have diabetes? So I'm going to list them. These are important. They're not all of them, but these are the most common ones that people present with. One of the most important ones is going to the toilet for a wee a lot more. Okay, so your waterworks are a lot more frequent than would be normally. So if normally a person goes twice a day, morning and evening, they might start going 4 or 5 times a day, getting up in the middle of the night to go to the toilet a few times more than usual. This is one of the main symptoms that somebody may present with. Feeling more thirsty. Okay, they're always feeling thirsty. They always need a drink. Their mouth feels dry all the time. Okay, number two, you can get just general tiredness, malaise, lethargy. So somebody's always feeling tired. They're not sure what's going on. Just don't have the get up and go. That can be a very subtle sign of diabetes. Okay, skin problems, itchy skin, skin infections. These can be signs of diabetes. Infections generally. So if you start getting things like boils, water infections, bladder infections, skin infections, recurrent sort of infections all the time, chest infections, any sort of odd infection that just doesn't clear up and you keep getting them again and again, could be a sign that you've got underlying diabetes. Problems with your eyes, so visual disturbance, blurred. More advanced ones, when somebody might have had diabetes for a number of years and not realize they've got it, people start getting sort of muscle aches and pains, tingling in their fingers, in their hands. They can get sort of numbness, loss of sensation in their hands and their feet. Again, visual disturbances as well. Losing sensation in their feet is a common one. So if they're cutting their nails or they bump their toes and they can't actually feel it, And this is a sign that they've had probably diabetes for years. It's damaged their blood supply, then their nerves in their feet and their hands. Um, more of a more of a sensitive nature, but I think it's important to mention with men sometimes problems with sort of their sex life. So inability to have a sort of a sexual relationship. This is a complication of diabetes as well. Damages organs, damages sort of nerve supply, blood vessels, and commonly it can be somebody who's ignored this for years and years. Actually, they've got underlying diabetes and they're not even aware of it. So that can be a symptom and a sign in itself, which is very important. And it should be highlighted because, again, it's a condition that, it's going to cause a lot more damage for that person. Is that okay?
Yeah, sure. So because I know we have the acute complications and also the chronic complications. So you've made mention of the chronic complications. If you can actually highlight on some of the acute complications.
Yeah.
Diabetes, yeah, as well.
So the acute ones, again, the type 1 diabetes is the one that has the more acute and more dangerous complications. And that's more serious. So I can touch on that. Again, it's like things like infection, weeing more, abdominal pain. Type 1 is much more serious because the sugar levels can completely go one extreme, high or low, and that can lead to death sometimes. It's that serious. So something called a hypo, which is basically low sugars, and that only happens usually in type 1 or type 2 if you're on certain medications. And a hypo means that your blood sugars drop very low, um, dangerously low. So your sugar in your body is as important as oxygen to some degree in blood in your body. So if you don't have enough blood sugar in your system, your brain is going to shut down, your body is going to shut down, and it's actually critical. It's life threatening. And a hypo, low blood sugar, beyond below 3 and even further can be literally can kill somebody in minutes. So it's a huge dangerous complication of diabetes. And the more acute ones are usually infections. So water infections, bladder infections, we call them, skin infection. These are sort of more common and acute sort of things that you might get. Um, Again, with type 1, I don't want to go into too much detail, but there's various advanced sort of conditions like something called DKA, ketoacidosis, acidosis of the body. It gets quite complicated, but if somebody wants to discuss that specifically, then I can go into it. But I think, for the general audience, I think these are the key areas that really would make any sense at this stage.
You know, with a frequent, urination, we have women in their menstrual cycle, especially maybe 3 days into maybe when maybe you're going to have your flow. Sometimes you have a little bit of irritable, should I say bladder? I mean, where you pass wee a lot sometimes.
Yes. Yeah.
Yeah. So can menstrual cycle or also can menstrual cycle or menopause affect your glucose levels?
So just going back to sort of the irritation you mentioned. So
Yeah.
bladder infections, thrush is a very, very common one. Thrush, especially in women. So down below is if a person is getting a recurrent thrush, it can be a sign that there's diabetes present there or a high sugar levels in the person's system. So that's another one alongside the infections. But in terms of menopause, or do you mean menopause, or do you mean the menstrual cycle in a young
The
person?
menstrual cycle or
Yeah, because when you talk about menopause, then we're bringing in other factors as well. So it's not the correlation isn't between the menopause or menstrual cycle and blood sugars. Hormonal changes impact the body. So the umbrella term I'd use here is hormonal changes. So when somebody is during menstruation or menopausal, there are fluctuations in hormones, estrogen, progesterone. There's various changes in hormones, and includes stress hormones as well, okay, in the female body. So while those changes are going on, and it's interesting because there's a type of diabetes called gestational
Yeah.
diabetes, which is in pregnancy only, and the person, the lady who's pregnant becomes diabetic, but it's only a temporary diabetes. It's during the pregnancy, and after the pregnancy, when they give birth, they usually go back to normal, and it's only for that pregnancy. And again, one of the key components is hormonal changes.
Mm.
So in the same way, menopause and menstruation, it's the hormonal changes that can cause an imbalance, and sometimes the stress hormones can cause an imbalance in the whole body that can sometimes be a factor in diabetes, but it's not going to cause diabetes. If it makes sense, it's not menopause that causes diabetes. It's not somebody who's menstruating that's going to get diabetes because they're menstruating. But these are associated factors. So when somebody's having a menopause because they are of a certain age, they might have other mental health problems. Their diet might not be good enough because they're stressed about other health problems. So various different factors come to play, and then diabetes can be the end result of it. But per se, diabetes isn't caused, or there's no correlation as such between these conditions.
Sure. Sure. So now we've talked about the types of diabetes. We've spoken about what causes diabetes and also the symptoms. I mean, how can somebody be walking around not knowing that maybe he or she is diabetic? Having pointed all the symptoms, because I'm thinking if you should be just visiting the toilet frequently, that should actually give you one or two signs. So I mean, how can somebody just be, I'm just walking around normal, having all these symptoms, but then still living a healthy life? How
Yes.
can that person still go on?
Yeah.
And also, for how long can they go on?
Yeah. Yeah.
Let's say
Uh,
like undiagnosed. Yeah.
yeah. Again, a very, very important point you make, that diabetes is one of those conditions. It's like high blood pressure and high cholesterol. Major conditions, all three of them, but they are very insidious in their nature, and they are silent killers. We call them silent killers because I'll give you an example. If you fall over and you break your leg, it's very obvious you've broken your leg.
Yeah.
It hurts, it's painful. You can see there's something not wrong, not right with it. There's a bruise there, there's obvious damage there. You go to the hospital, they do the x-rays, they put it in a plaster, or they operate on it, and the problem is solved. In various other conditions, there's a skin problem, you can see there's a problem. You put some cream on it or whatever. These conditions, there's nothing to see usually. You can't see them. So externally, when you look at somebody walking down the street, somebody sat next to you, you can't see this. It's like mental health. You can't see what's going on inside. You can't see the blood sugars. You can't see it on their face. You can't see it in their eyes. It's inside them, and they don't even know. And by the time sometimes the symptoms arise, the earlier symptoms of going to the toilet, being thirsty, feeling tired, by the time those symptoms arise, the person is usually quite, not advanced, but they've probably had it for a couple of years. They probably had diabetes for a couple of years, and now, because the human body is very resilient,
Yeah.
and it finds a way to sort of plod along. Sometimes you get people that they've probably had it for 5-10 years of diabetes, and by the time they get to the doctor, they've actually got damage to their nerve supply, to their fingertips, to their feet, to their end organs. When you check their eyes at the back, their eyes are so damaged from the damage of diabetes over 5-10 years. Their heart is even damaged, the kidneys are damaged from this condition, and yet they've been plodding along. So there's the resilience of the human body, but the resilience of somebody who wants to remain, I want to use the word ignorant, but just don't want to confront the problem. And
Yeah.
people's lives are busy. They just get on with it. Oh, well, forget it, and it's something trivial for them. So as I said, it's a silent killer. It can, erode your body from within. It's like hypertension, high blood pressure. You don't know you've got high blood pressure until it gets
No.
to the point where something bursts, or you get severe headaches. And by that time, you've probably had it for a number of years and not known about it. And it's the same with diabetes. So that's why it makes it even more important to be aware of this condition. Now, what I would say is that if we already know who the risk factors are, and people, somebody out there listening, again, I don't want to pinpoint it, but if somebody in their 50s, and is a male from a black Afro-Caribbean background, there's a very high chance you're going to get diabetes. If you and so what I always suggest is it's just a simple blood test. It's a very, very simple blood test. Go speak to your GP and say, can I just be checked for diabetes? It's a simple blood test, takes 5 minutes to do. The result comes back the next day, the day after, and that result can tell you where you are. You might not have diabetes, but it might tell you have something called pre-diabetes, which is you're at high risk of diabetes. And for the sake of a simple blood test, you could save your own life and your own health, because if you ignore it and you do it in 2 or 3 years' time when you have got symptoms, you will have created a lot of damage for your internal organs by that point, and something that you could have easily reversed if you'd caught it early enough. Does that make sense?
Sure.
Yeah.
Just to reiterate what Dr. Sohail said, we're just urging, people from our background, over 50s or mid 40s even, to have your MOT done, your health MOT done. And even if your GP does not call you, sometimes you can request it from your GP that, please, can I have my blood, tested?
Yes. Yeah.
And just to check my glucose level, and also to check my, my heart, my blood pressure and everything. So yes. So I think we owe it to ourselves, from time
Absolutely.
to time. Yes. Yes, to have all these, checks.
Yes, and it could be just once a year.
Yes, and we have people, even when they get that notification from their GPs, they just ignore. Yeah. Please, if you happen to get such notifications, please don't ignore. Don't ignore, because from what Dr. Sohail is saying, it's so damaging that it can, this can be in your body for 10 years. Mm-hmm. And you can just be, going on and going on and going on. So by the time they might have actually picked it up. Maybe your organs and everything might have actually gone. Yeah. And COVID has taken most of our loved ones away. We don't want diabetes. Yeah. To do that also to ourselves. So please, from time to time, have this MOT done on your body. Yeah. We just have one body, and we need to actually look after it very well.
Yeah. Absolutely. And just to add is that during COVID and generally, I think people feel that they're being a burden, or, well, I don't want to bother the GP, and well, it's not that important. Again, because people don't see anything wrong with them physically, and I think, well, I'm going to look silly if I go to the GP and ask for this. No, you won't. No, you won't at all, and never feel that way. It doesn't even matter what even if you're late 30s, early 40s, believe it or not, there are people in BAME background communities in the late 30s and early 40s who are getting type 2 diabetes because of lifestyle, diet change, factors that are involved in unhealthy eating. So anybody can really have diabetes. There's no textbook person that's walking down the street and you say, oh, that person's got diabetes. Anybody could have it. I know people who are young, fit and healthy, play football, they're quite active, and they've ended up with diabetes because of their diet and lifestyle habits. So don't feel like a burden. Contact your GP, get an MOT done, as you say, and get checked over. Simple as that.
Sure. So, what kind of foods can we avoid? Like in order not to get diabetes.
Yeah. The best problem, the best solution to a problem is always not to have the problem in the first place, as they say. So, so the key here is not treatment, and it's prevention. Prevention is the best cure, because you don't only want to get down the line that you end up with diabetes. So we all all your listeners and all of us here, we don't want diabetes. And again, from a cultural perspective, it's one of those that is trivialized. And I'm speaking from experience. My grandparents, both my grandfather had diabetes, he's passed away, my grandmother, and various elders in my family, and every time there's an occasion, family gatherings and special events or whatever, they'd be the ones eating the most sugary stuff. My grandfather's, God bless him, he loved his food, and he'll be eating away, and I tried to sort of nudge in and say, you've got high sugar, and you've got diabetes. Oh, it's fine, it's fine. So culturally, I think we trivialize it because, again, we don't see real symptoms. If somebody ate something and immediately gave them a stomach ache, that would be a natural instinct to say, okay, this is not good for me. This is my body telling me it's not good for me. So they'll stop doing it. But with diabetes, invariably, there's nothing really. So you can eat all you want to your heart's content. It's nothing really ever happens as such until it's the complications where you could get your legs amputated, your infections and gangrene and all sorts of things which are severe. But people, it's human nature that you don't worry about something that's not happening to you at this moment in time. And if it's happened to somebody else, well, that's fine. They probably had something wrong with them, but I'm fine because I'm okay. It doesn't bother me. You see what I mean? So it's a change. I think the important thing is changing perceptions and changing sort of the way we look at diet, health, nutrition as communities, and look at it as stand back and look at it because we do have quite specific diets in certain communities and high diets in carbohydrates. So staple foods like rice, breads. I don't know what your listeners' backgrounds are, but what
Yeah, we
for
have,
familiar.
yeah, we have fufu, we have eba,
Yeah,
and we
yeah,
have gari, we have kenke. I mean, all these staple foods.
yeah.
Yeah,
And these are like the bulk of your sort of plate when
yeah,
you eat.
for sure.
And likewise with myself, it's like, you get chapatis or you get rice or you get sort of naan, and these are the heavy beige foods. And if you look on a plate, you normally there should be a distribution of 30, 20, 10 this protein, vegetables, and carbs. But invariably, the carbs seem to be sort of 80%, and everything else is, you know, it's 20%. So we are very carb heavy as communities, I find. Um, so specifically, again, going into the diet side of it, it's a huge topic. It's a huge topic in itself, which we can touch on now. But from my background, again, I'm I promote and I talk a lot about health, well-being, nutrition, because I believe that these things are more important than ending up having to go on medications. So if we can prevent something and understand something and change our way of doing something and not get the condition in the first place. So there's it's all about sort of the balance, life and diet. So if you look back, and if there's an old saying of Hippocrates that let your food be your medicine
Sure.
and medicine be your food. And ultimately, diabetes as a condition and cholesterol, high cholesterol and hypertension, these are conditions, diseases of affluence. They are self-inflicted most of the time because it's what we consume. It's our consumption of what we on a daily basis. So ultimately, we have the control to prevent, to reverse these conditions. Okay. And it's the conditions that we've caused ourselves. It's like smoking. Smoking is very obvious because you see somebody smoking, they get lung disease. So the correlation is very simple, that well, you shouldn't have been smoking because now you've got asthma, you've got lung conditions, you've got lung cancer. Well, you were smoking, you know how harmful it is, you shouldn't have done it. You see what I mean? It's the same with diabetes in essence, because the core elements is the diet. Yes, there's genetics. Yes, there's other factors at play as well. But the core element and the control of it comes from the diet and what we eat. So if our nutrition, if our diet, if our intake is balanced, is healthy, is proportionate, and is measured, then it provides nutrition, it provides vitality, it provides balance. And when that balance slips and shifts, that's when we have disease. We're out of ease. We're completely in out of balance, and then it leads to illness. Simple as that. So the formula is very simple. If we eat foods in the right measure, in the right time, in the right proportions, it becomes our medicine. We don't need medicine. it balances us. It gives us nutrition and gives us all the energy that we need. And if we go over the edge with anything out of balance, it's going to cause problems. So it's not what foods to avoid and what foods to eat. It's more how much to eat and in what proportion. You know what I mean? So I don't like advocating that no more carbs. There used to be this Atkins diet. I don't know whether you come across it years ago. The keto diet, the Atkins diet. There's loads of different diets that are low carb, no carb, and whatever. And ultimately, people really lead to harming themselves when they do these diets because they go so extreme in protein only and this diet and that diet. And that shouldn't be the case. Life shouldn't be so miserable for people. Just have a balance. So I never said stop carbohydrates and stop rice and stop cakes and stop. Don't quote me on this because then people go running out and then Dr. Sohail said you can have all the cakes you want, but it's in measure. It's all in measure. It's in proportion. You exercise, you walk, you burn those calories, you drink, you eat, everything in proportion. But cut out the things that are not necessary. So start with small things. So if you like tea, if you like coffee, cut out the sugar. If you have three sugars, go down to one, and then move down to no sugars because it's not adding any value, health benefit to you. So try and cut out the sugar. If you like having biscuits instead of 5 or 6, go down to 1 or 2. You see, so it's just,
I'm
you know,
guilty.
you see what I mean? It's kind of, or go for the healthier options. Go for oat biscuits, sugar free, rather than, I don't know, the double chocolate dipped in cookie biscuits or whatever. you know. So it's making those changes that are measurable, that are not too extreme. It's not going on a diet. It's making lifestyle choices that are lifelong, that are small changes, that are not going to cause you harm and upset you, and cause you to be withdrawing and becoming very irritable and annoyed with people because you didn't get your donuts that day. It's kind of making small changes. you know
Definitely.
so
And don't you think that that has also got to do with our income brackets? Because sometimes you just want to fill your tummy. You know what I mean? Because you like you wouldn't have maybe the luxury to have maybe 3 square meals where you can have it in like in the right proportion. So
yeah.
thinking, okay, maybe I can have my my chapati with my curry, heavy, and then
Mhm.
once and for all. Don't you think sometimes it's also got to do with our income bracket? I don't know, but
Yes, no, you're absolutely right. And there are statistics out there. There is a lot of data talking about this, where the income bracket, like you say, and the deprivation, it's in complete disproportionate, inversely proportionate to the health of. So diabetes tends to be higher, hypertension tends to be higher. These conditions, chronic conditions, in those that have deprivation, so there are poorer background. Again. The side of the financial side of it. So people who are well off can cook for themselves, can pay for better ingredients, can go out and buy nicer things, and go to Waitrose and Marks and Spencers and I don't know where else. But those that are poorer, they'll just go and get a Big Mac and think, yeah, that's fine, yeah, or whatever. In Bradford, we have the 99p chicken and chips or whatever, and yeah, that'll do me, kind of thing. But I think that it's one factor, but it's misleading in the sense because it's not the lack of money or the resources. I think it's the lack of education, the lack of understanding, the lack of empowerment, because one hand goes in hand. Those that are more educated, have more money, are probably more educated about their own health and well-being. They're probably members at a nice fancy gym somewhere. They're more empowered about their own health. They want to live longer. They probably don't smoke. They probably don't go out to eat as much. Do you see what I mean? So there's a lot more involved. But those on the lower bracket of income, essentially, if you think about it, if it's a burger, or if you go to some supermarket, you see some bananas, apples, strawberries, all these things, and you buy the same amount of proportion of all those things, and then on the other hand you buy cookies, donuts, carrot cakes, and I don't know what else, all this nice stuff. If you look at it in terms of how much you're going to get, it's usually the same price. It's usually, there's not that much difference in the price of the not so good stuff versus the healthier stuff. You see what I mean? So again, it's more about empowering those people with the skills, the understanding, the knowledge, healthy foods, cooking healthy foods for yourself, and creating a menu for yourself, and having a balanced life. So it's about actually the skill sets, not about the availability of these things. If that makes sense.
Yeah, yeah. So, what are some of the conditions associated with diabetes? Because, you've made mention of the hypos, the hypers, but I think I came across, some of the conditions associated with diabetes, like, the thyroids and the celiac, diseases associated with diabetes, which is very, very,
Yeah,
strange
yeah.
and also disturbing. If you can.
Yeah, there are again with I'll focus on type two, because type one is what we call an autoimmune condition where your own body attacks the organs that produce the hormones in diabetes, and those are linked with many other autoimmune conditions like your thyroid and skin problems. But focusing on type two diabetes, the correlation with other conditions and the link comes from the damage that the diabetes is doing. So somebody who has diabetes type 2, the over the years, the damage that the diabetes causes leads to kidney disease, damaged kidneys, leads to heart disease, damage to the heart from the high blood sugars, leads to sort of diseases of the brain as well, leads to disease of the eyes, limbs, loss of many organs in the body, reproductive organs. So these are all the conditions that are connected to uncontrolled chronic diabetes. In essence, they're not linked as in you don't get one because it's not like you get diabetes type 2 and now you're going to get this condition as well. It's on the basis that you haven't controlled it, or you haven't managed it, or it hasn't been picked up soon enough. So it's a complication rather than an association with diabetes.
Sure. You know, how can diabetes be delayed or prevented? Because you've talked to us, about the kinds of food that we can avoid, and also trying to eat in smaller proportions, even if we want
Yeah,
to. I mean, not in bigger. I mean,
yeah,
how can we delay or prevent diabetes?
yeah. So I'll go to the question that the person asked as well earlier. I think the person was saying that they were diagnosed with diabetes and then 5 years, and then they've not needed medication, and I think it's reversed or something of that nature. So in essence, diabetes is a chronic condition which usually progresses. Okay, so what that means is that it's an ongoing condition, and it usually gets worse if not managed and controlled properly, and the complications get worse. A lot of times people ask the question, can it be reversed? Yes, the simple answer, yes, it can be reversed. And not completely, but if caught soon enough. So again, as a case example, if I give you, if somebody was to go to their GP and say, look, I've got these symptoms, I need to go to the toilet regularly, just feel tired, can I have a blood test? They do the blood test, and the level comes out as pre-diabetes or borderline. So it's the sugars are high, but you're not officially diabetic yet. Okay.
Yeah.
What that means is, for example, you might have a level of 48 or 50, the number that we give on the HbA1c. So what that means is that if you carry on doing what you're doing and you don't do anything about it, this time next year when you repeat this blood test, it's probably going to be 55 or 60. Then you will be a diabetes patient. Okay. So at that point, you're just about borderline. Okay. Now, if you make those diet changes, you make those lifestyle changes, you lose weight, you start exercising,
Mm-hmm.
in a year's time, that 50 can go down to 30, 35, 40. You can be normalized again completely. Okay. And allow your body to recover fully and go backwards. Okay. And at that stage, they don't start medication. They look at you and they say, okay, fine, this is where you are. This is not looking very good, but you can reverse it. Or you're not even been diagnosed at that time. So they don't rush into medication straight away. They give the person an opportunity, say, okay, let's make some lifestyle changes. They give you diet advice, whatever else advice that we have. Make these changes and let's see what happens. And they'll check your blood sugar levels again, usually in 3 to 4 months' time, to see what's happened. They don't rush into medication. Even when you have gone onto medication and you make significant lifestyle changes, and the medication, you can come off and potentially not be on any medication if you've made significant changes to your life and you maintain those changes. It's not like, oh, I'll behave myself for a month, it's New Year's resolution, no more biscuits, and you all of a sudden get your levels back to normal, but then come March, you're back on it again. It's going to come back. Do you see what I mean? So it's not a month or 2 months. These are sustained changes. Otherwise, the monster is going to come back. It's not going to go away. The diabetes will come back, in 6 months, years, 5 years. You see what I mean?
Okay. I've got a lady called she's called Naomi Asani. That she sent a question. Yeah, she goes, can gestational diabetes be self-inflicted?
Um, by self-inflicted, I'm guessing the person is referring to diet, their own dietary choices, and the answer is usually it is. In type 2 diabetes is as well. So if you have I refer to it as a poor diet, as in if you're living on high carbs and you're eating sugary stuff and sweet stuff, that is inviting diabetes, that is leading to diabetes. So yes, if that's what you're doing and your diet isn't the best, and you're having a very high sugar intake of diet of in your diet, then it will lead to gestational diabetes while you're pregnant. And an important thing with that is that it impacts your child as well. The baby in the womb will be impacted with the diabetes and can cause complications in pregnancy. So it's even more, it's not just about you as an individual, it's about the child as well that you're carrying. And it's a marker, gestational. So somebody who has gestational diabetes, as in they get diabetes when they're pregnant, it's an indicator that they will get diabetes later on in life usually. It's a clear indicator that they will get diabetes later on in life. So yes, to some degree, yes, it is self-inflicted. It's diet related. Yes.
Wow, wow. I mean, now we've spoken about the symptoms, the causes, what foods that we can eat. I mean, what to eat and what not to eat. I mean, which obviously is just being sensible with what we put into our body. Now we just want to talk about the medication and its side effects.
Yeah. So again, I'll touch on briefly. Type 1 is only insulin, because in type 1, the body is not producing any insulin at all. So there is no other way around it. You have to be given insulin artificially because your body isn't producing it. So that's simple. That's type 1. In type 2, there are many, many, many different medications. So it's a stepwise treatment approach. So you start off with diet changes and lifestyle changes, and you say, okay, give it a go and see what you can do. If it doesn't work and 6 months have passed and your levels are getting worse and worse, they start off with first line medications, and they're all tablets usually. So first line, second line, third line, and all of those are designed to either increase your insulin levels, hormone levels, or reduce the sensitivity of insulin in your body. So they work. There's many different types, and they work differently. I don't want to go into the details of how they work, but in essence, they are trying to balance your blood sugars. Now, if you are on one, it doesn't work, you add in another one, they add in another one. And ultimately, as a type 2 diabetic, people sometimes end up on insulin because they've been through all those steps of medications and nothing's controlled it. And it's just got worse and worse and worse over the years. And a lot of people end up on insulin as type 2 diabetics as well.
That's shocking. That's shocking because I think we've all made like we've all made to know that it's just the type 1 diabetics that's solely rely on insulin. But I think this is my first time of hearing that
No, many type 2 diabetics end up on insulin because they might be on 3 or 4 tablets and they still are not getting under control. And ultimately, they end up on insulin. And there's many people. My own grandparents were both on insulin as well. So it's very common to be on insulin in the end when nothing else is controlling it.
Yeah. So I mean, how can we manage diabetes? I mean, after going through all the treatments, and
Yeah.
I mean, how can somebody with diabetes manage it?
Yeah. So again, it's diet, lifestyle, weight, proportions of what you eat and how often you eat. If a person is diabetic and they've got the diagnosis on their own medications, they usually have their own machine given to check their blood sugar levels. It's always a good idea to monitor that as well, to see where you are. But ultimately, it's an understanding. I remember years ago when somebody was diagnosed with diabetes and a patient, and we couldn't work out. Every time this chap came back, he looked well. And he was adamant his diet was perfect. I mean, I don't eat any biscuits. I don't eat any of this stuff and this and that. And he was like convincing in any way. And but his sugar levels just kept going up and up and up. And it took months and months, but finally he kind of confessed in just a passing comment that, oh, I like that juice. I think they used to call it Sunny D's, Sunny Delights, or something like that. Um, and the point being here is that sometimes the perception of a person is that something's healthy. So he was looking at it thinking it's a fruit juice and it's like healthy. It's 5 a day. So sometimes they promote these things in the shops as,
Yeah.
oh, one of your 5 a day, or it's one of your 5 a day and one of this and one of that and Ribena or whatever. I'm just saying. So this chap was thinking, yeah, I'm having 1 a day of my intake of fruit and it's healthy. But you turn it around and you look at the sugar in there, yeah, they've got probably one orange in there and 20 bags of sugar in, so you see what I mean? So the perception of the person, sometimes people don't realize that some of the things they're eating and drinking unknowingly are actually harmful for them. And there was certain drinks or certain things are loaded with sugar. I mean, you go to some of these, there was a study done a couple of years ago on Starbucks or one of the other ones, and they found how much sugar they have in their latte, how much sugar they actually have in their mochas and whatever. And it was like 12 or 18 teaspoons of sugar in a normal
It's
latte. I mean,
ridiculous.
and imagine that if they put that on there, yes, this includes 12 spoons of sugar. Nobody would drink it, but we drink it.
No.
It tastes nice and think, yeah, that's nice. Yeah, it's just a. And there's people that drink 2 or 3 lattes a day at work, but when you explore further, so you see what I mean. So the point I'm trying to make is that it's our understanding and awareness. So you sometimes just have to be a lot sharper, a lot more what's the word to use, like just more clued up in terms of what you eat and drink. When you buy something off the shelf, turn it around and read. And what you need to read is the carbohydrates. So everything, I don't have any food with me here, but if you look at any pack, you turn it around, it always gives you fat, protein, salt, carbohydrates. Look at the carbohydrates, look at the carbs, and you'd be shocked. Like one hobnob has 20 carbs in it. You know what I mean? So if you start looking at it from that point of view and measuring things, then you realize that actually what is damaging you. Nana, you're going to hate me after this. You're going to think, oh
No,
my
no,
God, this.
because no, no. Look, what I want to know is how come carbohydrates are so addictive and also it tastes so nice. I don't know. I just want to find. I mean, how something that is so damaging to our health is so addictive and also it's so nice. It's so good.
Yeah. Well, this is it. I mean, we can go down the whole the line of sort of the food industry, but the point is, it's not the carbohydrate that tastes nice. It's what's being created out of it. So the other ingredients, the other sort of elements, the chemicals, the addictive nature of it is the high it gives you. It's like a drug. So when you have something sweet, you feel good because it goes straight to your brain and you get a high and you feel a sugar rush and you feel energized and you get a bit of a boost. It's like comfort eating. So that's what gives you the high feeling. It's literally a drug in some respects. So you get that boost and you feel good. So your body likes feeling good. So when you're feeling a little bit tired, just grab that, donut or whatever, have that cup of coffee on top and you feel boosted and energized. Okay, and your body likes that feeling, and that's why it's addictive. But the more addictive nature of it is the other ingredients in the food, all the other stuff that goes in. So there's good carbs and there's bad carbs. So for example, you could have porridge in normal milk without any sugar. Okay, that's a wonderful carb and it'll taste fine. But then you can put in sugar and all sorts of other stuff and maple syrup and chocolate in there, you know and pecans and almonds and just grab that and mix it up and make it into something and then you have that you see what I mean?
Yeah, sure. Sure. Wow. Wow. How can people learn to accept and live with diabetes condition?
learn and so live with diabetes.
Yes, because
Yeah.
I think the reason why people, escalate into, these acute conditions, sometimes is a state of denial. Sometimes people, still don't accept the fact that maybe they have diabetes,
Mm.
and
Yes.
they don't follow
Yeah.
instructions, or even
Yeah.
take their medication. But then, you
Yes.
being a doctor here tonight, what kind of advice can you give to such people in order to, fully accept that, look, you have this condition,
Mm.
and with proper management,
Yeah.
you can still survive. So,
Yeah.
what kind of
Yeah.
advice can you give to such people?
Yeah. Yeah, that's an excellent point, and sometimes these sort of more subtle psychological impacts of a condition are forgotten many times because we, as clinical people, say, "Yeah, you've got diabetes," and we forget the stigma sometimes. So a person, when they diagnose with diabetes, what does it mean to have diabetes? When somebody tells you, "Oh, you've got diabetes now," what does it mean, and what stigma is attached to it, whether it's a community stigma, or whether somebody might, oh, that means I'm getting old, or that means I'm going to die, or that means I'm going to have a stroke, or I'm going to have a heart attack. And it's so many stigmas attached to it. And the other factor to it is that sometimes it can actually affect the mental health. It's like, it's not as bad as cancer, but it's obviously, it's a diagnosis, it's a chronic diagnosis. And if a doctor turns around and says, well, there's no cure, this is it for you, there's no cure. It depends on how you get that news broken to you. What I would say, again, we go back to the foundation of this whole evening, is empowerment and education. And what that means is that we need to shift the way we look at diabetes. We need to shift the way we interact with diabetes. It's not a death sentence. It's not a condition that you are now you are going to have to live with you necessarily, or you have to be resigned to have this hanging over your head. I would say people should see it as an opportunity. If you go to the doctors, you have a blood test, and they say it looks like you've got diabetes, take it as a blessing, take it as an opportunity. Why? Because first of all, at least you've got diabetes.
Yeah.
Could have been 5 years and you could have lost a limb and be blind, and then find out, oh, you've had diabetes for 5 years and nobody told me. You see what I mean? So the fact that, in this modern day and age, it's so easy to diagnose and to find this condition. There are places in the world where there's not really much healthcare provision, and they don't have these tests, blood tests, to check for diabetes. And the only time somebody finds out they've got diabetes is actually when they die from a complication, and they find out, oh, this person had diabetes for the last 20 years and nobody knew. And I've seen that in many countries around the world where the people have been living with diabetes and they've just not even known. So first thing is the fact that you found out, it's a positive, because now you've got a problem, or you've got an issue that needs looking at, and take it as an opportunity to step back and reassess your life, reassess your choices, reassess your diet, your lifestyle, and look at what's important. Reassess your life. What is important to you, your children, your career, your loved ones, your health. What is more important than your health? This is all we have, our bodies. This is all that belongs to us ultimately, is our own health and our own body. So take it as an opportunity and say, okay, fine, I've been given this now as a diagnosis, and I can change this. This is something that you can change, and it's within your power, literally in your hands, to change this. Either you're going to go in this way and it's going to be cakes and buns and all sorts, or it's going to be choices that can change your life forever, and you have that choice to make. So take it as an opportunity to change your life, change the lives of others around you. Start running, start exercising, start losing weight, start making those positive changes. And because of those positive changes that you make because of diabetes, I can guarantee you, because all of these conditions are interconnected, that you will lower your cholesterol, you will lower your blood pressure, you will lower your anxiety, you will lower your stress, you will have the ability to make so many changes and potentially increase your life and by many years, 5, 10 years. Imagine that. But it's not just about the numbers that you're adding. it's the value and the quality of life you're going to add as well. Because you could have 10 years with diabetes and all the complications of diabetes, or 10 healthy years of managing diabetes without any complications, because you took that step and took that sort of action to change your life proactively.
I'm so happy that you made mention of high cholesterol and also high blood pressure, because a friend just sent me a question that says, how do other factors, example high cholesterol and high blood pressure, affect one if they have diabetes?
Yeah. So again, they are linked, because the dietary choices that people would make, and sort of the high carb diets usually tend to be high in fat, usually tend to be high in cholesterol levels. So that will automatically, so one goes hand in hand. If you have diabetes type 2, there's a very, very high chance you're going to have high cholesterol. When you've got both of those, there's a very high chance you're going to be overweight. There's a very high chance if you're overweight, you're going to have high blood pressure. So it's like a domino effect. They're all linked in that way, because they're all, silent killers. They go all hand in hand. And when they all come together, they create this whole concoction of illness that will ultimately go down the road of heart disease, heart attacks, strokes, and all of those nasty sort of chronic conditions. So they're all interconnected. So making one chain is like a chain that's connected: diabetes, cholesterol, high blood pressure. You break one piece and you make that better, then the other one falls into place, and the other falls into place, and overall you've got a healthier life if you manage one of them.
Wow. As damaging as diabetes is, um, how come, or should I say that, what can we do, to conscientize people, especially, within the minority, background, to be informed about some of these things? Because it looks like until you get called by your GP to have these blood tests run, you don't get to hear or even know about your diabetes status, or your blood pressure status. You don't get to know what can be done to sort of um, get to, I would say, like, into the community very, very well, where we can be properly empowered and also educated on this disease.
What
Is
can be
there, are
done? I
there
mean, sorry.
any workshops that maybe we can maybe do occasionally, where we can just educate, our own, on these
Yeah, yeah,
things?
yeah. Well, this you've made a start here. This something like this is the amazing work that you're doing, and this is what we need, regularly, for people out there to be on these sort of platforms, to engage with their own. The issue sometimes is that, in the UK, particularly general practice, over the years, it's become, the model has become that you turn up to the GP, or you turn up to seek help when you're unwell, and when you're really sort of battered and bruised, and now you need help. And unfortunately, in the system that we are, that there's not enough focus on health promotion and prevention of disease. You see what I mean? So what we have to push for on a practical level is, like you say, workshops, targeting those communities, targeting those people who are high risk. And this is something that I'm working on with the organizations that I work with in Bradford here. And it's a key area of passion of mine, is to promote health and well-being.
Sure.
And the thing is, we can't, as healthcare practitioners, I think the problem we have is, we wait, sat in our offices, for somebody to knock on our door and come in and tell us, well, doctor, I don't really feel well. I don't think that's the way we should be doing it. We should be going out, and we should be going out in the natural habitat of those communities. And whether those are churches, mosques, community centers, shopping centers, whatever out there, we can find. And we need to go there, and we need to get that audience, and we need to stop and talk to people. And we need to set up, like you've done here, this Zoom call, set up these sort of events for different communities, because these are, health is a matter for everybody. It's not a matter for elderly folk, and it's
Mm.
high blood pressure, diabetes, cholesterol, heart, lungs. All of these conditions affect every single person, and it matters to every single. If it doesn't matter to you, or It's not a problem for you. I can guarantee you it will be a problem for either your parents, your children, your loved ones, your
Yeah.
spouse. So in some way it affects everybody. And we owe it to ourselves and our communities and our loved ones to at least be aware of it. If we don't want to do anything about it, that's our own choice. But at least be aware of it and be aware of the risk that we're taking.
Thank you so much. We are nearing, our discussion. But then, how often should a diabetic, be seeing their doctor to optimize, their diabetes management? I mean, how often?
Yeah. Again, these are case by case. It depends on the person's blood sugar levels and how bad their diabetes is. Normally, here in these surgeries, we have a diabetes specialist nurse or a GP in the practice that is a diabetes specialist. So they will do a blood test firstly, and depending on the result, they will follow you up usually in 3 to 4 months. And then, depending on the second result, they will follow you up in a year's time or 4 months' time. So it all depends on your progression. If you do really well and manage to reverse it in 4 months, you don't need to be seen again for another year. But if you've got worse and worse and worse, so it's all tailored to the person's individual case.
Okay. Yeah, my last question is, especially in a community where we see hospitals, as a death sentence, um, what should people expect, just to calm their nerves? What should people expect, like on their first appointment with their diabetes educator, you know, because sometimes people are not too sure what maybe they are going in for. So maybe to educate somebody who has been diagnosed with this disease and thinking, I'm not going anywhere because I don't know what maybe this diabetes educator maybe is going to tell me, or I don't know what maybe the GP is going to do to me next. What kind of advice would you want to tell to the person?
Is this person who's worried they might have diabetes or have actually been diagnosed with diabetes? Sorry.
Has been diagnosed.
Yeah.
So it's what like about their first appointment with a diabetes educator.
Yeah. Again, this goes back to your previous question. If I add to that and answer this one as well, is that when you say what should we do or what can we do, another important thing is accessibility. So what that means is in terms of sometimes there's the language barriers, there's cultural barriers. People don't want to speak to or find it intimidating to speak to somebody, or English might not be their first language. So they can't communicate the severity, they can't communicate the changes that need to be made. And so these sort of things always need to be taken into account. So what I would say is that never be afraid or never be shy to ask for clarification. Don't be intimidated, because ultimately it's your health. Okay, it's a person who's going in. It's your health, and you are the most important person. Okay, it's not about the nurse or the doctor that you're going to see. Forget them. They're fine. They're living their lives. This is about you. This appointment is about you and your needs. Okay, so if you are ever in doubt and you're not sure, you ask for clarification. If you have trouble in any information, accessing information, so you don't understand the language or it's too complicated, ask for somebody that might be available who can speak the language that you need, an interpreter even. Ask for clarification. There are many, many resources online, NHS resources, websites out there, videos even on YouTube that explain diabetes, that explain management of diabetes in multiple languages on the NHS and on YouTube as well, multiple languages. Ask for those resources and ask as many questions. And it's always good to read up or learn as much as you can before you go to the appointment, because you don't want to be overpowered by information on that first day. So this is your journey, and you travel to your speed and your comfort. Don't be pressured into any decisions. If you don't want to be on medications and you'd rather do lifestyle changes and whatever, don't feel that you are now sentenced to start medication. It's a shared decision. And if you're ever unsure, ask the questions. Never feel pressurized to make decisions or start medications or start treatments that you're not comfortable with or you're not happy about or you don't understand.
Thank you so much. I've got a question all the way from Switzerland. Let me just, I think I'll have to. It's called Korea Donko. Says, I'd like to know. I was doing very well. I didn't feel anything bad. For me, I was doing okay One day I got up, the hospital said that my blood pressure was up to 230. I would like to know why.
Yeah.
This is another question from
So
someone from Switzerland.
yeah, this, I mean, it's not really relevant to diabetes as such.
Okay.
And again, in terms of the question itself, um, there are so many factors. There are so many factors that can increase your blood pressure. So I can't give you an answer as to why your blood pressure was so high. There are so many factors. Ranging from health problems to stress to anything. So I have no idea what happened. You could be watching a TV program that makes you very angry. Your football match is going the wrong way. Your blood pressure is going to shoot up. You know, so I can't give a concrete answer there. I don't know. It could be thousands of different reasons. That do that. So one needs to know the medical history, the medications, the background, the circumstances. It's a 20-minute consultation just to absorb all that information and then work out. All I would say is that blood pressure is very high. So make sure you see somebody about it and make sure you get it looked at and don't ignore it.
Thank you so much, Dr. Sahil. So your final words and also maybe your suggestions, anything that maybe you want to tell. I've got a lot of comments coming in. We've got he's already answered that question already. Yeah, so we've got Naomi Asani saying, thanks so much, doctor. And he's also saying thank you so much to the Inside View. We've got a few up there. I've got Adelaide Hagen, also from London, says thanks, doctor. I have Mansford Asante Senior. It was very informative. Thanks, Dr. Sahil. Making change that's measurable,
Yeah.
not extreme. Thanks. And also we have any more? We have Patricia Essel also say good program. That's it.
Yeah.
So if maybe your final words
from my point of view, again, thank you very much, Nana, for this brilliant platform and the efforts that you are going to empower and educate and support your viewers and your communities. It's really admirable, and we need more people like you. And your listeners as well. You need to get this information out there. This needs, this is for other. I don't need this information. This is my day job. This is for you. This is for the listeners. So, please feedback. If you want more topics, I will take the feedback, and I'm sure Nana will take all the feedback as well, because these sort of topics, these are about you. This is about you, the listeners, the people out there. It's not a lecture. It's not a my time to talk about anatomy, physiology, all that. This has to be about the listeners, about the community, about the people, and ultimately, it's about everybody's health. If we're all healthy together, then we're a better society, or a better community. And what I don't believe in, we live in times now that things are so complicated. They've been made complicated. Social media, latest fashion, latest diets, latest this, that, the other. Try this, try that, the other. And health is simple. Always remember that health is simple, and nature is simple, and our bodies. When we are in tune with our bodies, they talk to us. It might sound silly and it's not scientific, but ultimately, you as people, if you are in tune with your body, you know what's right, what's wrong, and what's in balance and what's out of balance. And when bodies are in balance, what you put in, you are what you eat ultimately, and that is true. And if you eat bad, and you take in things that are not good for you and harm you, then that's the result that's going to happen. It's going to imbalance your body. So I don't believe in complicating things. Things have to be simple. Life is simple, health is simple, and the simpler you make it, the easier you make it for yourself, the happier you will be and the healthier you will be. And never let anybody complicate things for you. Never feel pressurized or overwhelmed. Look after those around you.
Sure. Thank you so much, Dr. Sahil. Thank you so much for your time. Considering how busy you are and to spend this valuable
Pleasure.
time with us.
It's a
You know,
pleasure, absolute pleasure.
we commend you so much, and we thank you for looking after us tonight, and also for
Thank you.
educating. For educating and also empowering us, because tonight we've been empowered, and I hope we are going to make the right choices, and also we are going to be in tune with our own bodies. We're going to listen to our bodies, and just like you said, you are what you eat. So henceforth, we are going to watch what we put into our body. We are going to, exercise more. We are going to, look after ourselves very well. So I'd like to say, let us be each other's keeper. Let us be each other's keeper. And after this program, you can share the link as many people, maybe, to your loved ones, maybe back home, they can listen and also be educated on some of these things. And just like you said, some people might be walking around for 5-10 years without not knowing that they've got this hidden disease in their bodies. So, we can keep this information to ourselves. Thank you so much, Dr. Sohail. Thank you. And thank you, listeners, for your time. And, until I come your way again next week, I'll say thank you and enjoy your weekend. Thank you, and thanks for watching. Bye-bye.